Welcome back to part 4, and there are only a couple more slides, so we're close. We were talking about wheelchairs, and I think I got to the end of that, but I also wanted to make a point, which is to always set the brakes on a wheelchair before transferring the patient into or out of the chair. This can cause injury for both yourself and patient if you do not have the brakes locked. So here are some management of fracture tools or items. And when a patient is diagnosed with a fracture or another injury that requires immobilization, the provider must decide whether a traditional cast, splint, or brace is most appropriate to promote the healing. And you can find figure 1923, which shows these examples of braces and splints. Assisting with casting. And this is something that if you're working in orthopedics, you would do quite often, but in all the other specialties, obviously it's not seen that much. So I want, except for pediatrics or general care, but I want to make sure that you understand assisting with casting and that you know where to find it if you do end up going into an orthopedic specialty to spend more time on it then. So casting materials include plaster of Paris, fiberglass or plastic, synthetic material or air casts, and the area first is wrapped with cotton padding to protect skin, and the splinter cast must cover the joints above and below the fracture. If swelling occurs, the patient should elevate the limb and apply ice around the splinter cast. If the patient needs to wear a cast only when using the limb, synthetic casts are available in the shape of a boot or a sleeve with Velcro fasteners that fit like a sandwich over the fracture to immobilize the area. And an air cast is a temporary cast that is inflated around the limb to immobilize it. In procedure 19.4, you will be looking at how to assist the provider with patient care by assisting with the application of a cast. And again, I just want you to note that procedure as well as 19.5, discussing how to assist a provider with caring for with assisting with the cast removal. Please take some notes and understand this, but we won't be spending a lot of time or doing the peer lag checkoffs. I just want to make sure that you understand the procedures and processes and that you know where to go back and really look at it. So there are some warning signs after application of splinter casts. It's important for you to know this and to educate the patient. Increased pain and or feeling that the splinter cast is too tight, numbness and tingling in the affected hand or foot, burning and stinging because of pressure on the skin, excessive swelling below the cast, and loss of active movement of toes or fingers. And make sure to tell the patient to contact the provider's office if any of these symptoms occur after the application of the splint or cast. And the patient education that you would give for care of splinter cast is we want to keep the device dry, stay off the walking cast until it dries. So once it's applied, they should not be putting any pressure until that cast has dried. Prevent dirt from getting inside. Do not pull out padding. Do not use objects to scratch. Do not break off rough edges. Inspect skin around the cast and make sure that there isn't any inflammation or signs of infection. Inspect casts regularly for cracks or soft spots. And the American Academy for Orthopedic Surgeons has made these recommendations for caring for a cast and splint. So it's important that they know these before they go home and that they understand so that they can follow. Let's look at the legal and ethical issues. So it's important to remember that you must have a written order before performing a procedure. You must follow the procedure precisely as ordered without variation. You never advise the patient without being asked by the physician to advise them on something specifically. Make sure you know what instructions the provider gave to the patient so that you can reinforce these instructions. If you have concerns about procedures, discuss with provider privately before the procedure, obviously not in front of the patient, and do not perform a procedure if you are uncomfortable. Make sure that you get someone to help you. Always remember you are the assistant and this is the provider's patient. Again, you cannot diagnose anything. You are not able to give any kind of advice, and we just always need to remember you are there to assist the provider. If you do feel uncertain or unsure of any order that a provider has written for a patient, you want to clarify before you proceed, and you want to do that privately with the provider. And yay, we're to the end. If you have any questions, look at the question and answer board on Canvas or bring them to class or both. And I look forward to seeing you. Have a great day. Bye-bye.